I'm very excited to be able to present today. My name is Dr. Jennifer Cardinal, and I'll be presenting on how we can develop and support our children and our students in developing their executive functioning skills with the big picture, of course, of helping them prepare for the workplace. When we look at executive functioning, it's important to look at the different definitions. We'll be primarily looking at some definitions that have been developed by Dr. Russell Barkley. In general, executive functioning is a type of self-directed action that includes our ability to restrain ourselves, to be aware of ourselves, to direct our own attention, and to use associated mental strategies that include problem solving and working memory. Executive functioning is a meta-construct, and it really represents the integration of mental modules or a wide range, really, of neuropsychological capacities. Executive functioning represents our ability as sentient beings to consider our past, and then in context of how we view ourselves, our own awareness, how we take that past and anticipate the future, and how we guide our behaviors towards that future. All right, the next slide focuses on the aspects of our brain where our executive functioning is really located as far as control. Executive functioning governs many lower level abilities, and although there's some controversy about their physiological basis, most people who study these abilities agree that the frontal lobe of the brain is the portion that plays a major role in executive functioning. The frontal lobes are the large portions of the brain cortex that lie near the front of the brain. The cortex is the side of the brain where lower level processes like sensation and perception are processed and are integrated into our thoughts, memories, and abilities and actions that we plan and initiate. So people with frontal lobe injuries have difficulty with their higher level processing that underlies executive functioning. And we'll get to this later, but the complexity of the frontal cortex implies that or results in it developing more slowly than other parts of the brain, and not surprisingly, because many executive functions are representing more complex underlying processes, they do not fully develop until adolescence or older. There's many researchers who believe that full development of the frontal lobe doesn't occur until the mid-20s. So with the higher level, this frontal cortex develops more slowly. So in looking at the slide itself, when we consider the higher level processing, then we have to naturally assume that processing or type of processing becomes critical to our overall success or failure. Executive functioning is linked to our ambition, drive, our motivation, our complex decision making. Okay, when we go to the next slide, we're looking at, when we look at it in context of society and the kind of evolution culturally of our different cultures, the frontal lobe really is what encapsulates our ability to be distinguished as humans. Dr. Goldberg, who's a famous neuropsychologist, talks about that frontal lobes are the most uniquely human of all brain structures, and he refers to human evolution as the age of the frontal lobe. I like how he describes the frontal lobe. I often talk about the frontal lobe and our abilities today to executive functioning to, for instance, an executive secretary that helps the CEO in managing an organization. And Dr. Goldberg compares the frontal lobes of the brain to a conductor is conducting an orchestra. They coordinate and they lead other neural structures in concerted action. And then related again to culture and society, many of our celebrations that introduce youth into adulthood correspond to that time frame when our frontal lobes are more fully developed. When we look at deficits associated with injury or dysfunction in the frontal lobe, we know that we can have severe changes, well, depending, of course, on the nature of the injury or deficits, but we can see severe effects on our ability to sequence, make decisions, even on our personality, and that's, pretty common knowledge. We've all heard stories of how different people can present as far as their personalities after frontal lobe injuries. It affects our problem solving, our verbal expression, and how we regulate our emotions. And there are, many reports about the struggle with impulse control, with deficits associated with frontal lobe functioning. One thing to keep in mind as we go through the deficits that come along with frontal lobe issues is that, as Ari Tuckman wrote in his book, Understand Your Brain, Get More Done. I love this quote. He said, executive functioning deficits make it easy to misinterpret actions and what they mean about a person's traits and skills. So when we look at that, remember as parents and as adults who are supporting our children that have serious executive functioning deficits, how do we remind ourselves that executive functioning with the deficits that we've already gone over in more clinical terms, day to day, often we interpret that presentation in ways that can be harmful to our own ability to see our children and those that we're helping in a way that's positive. Because sometimes human nature will have us interpret those symptoms as with adjectives like he's a hothead, he's a big talker, or she, they're distrustful, lazy. I did have a client literally just the other day who has a young boy, but when she was trying to describe his behaviors, he's since been diagnosed with ADHD inattentive type. As she described his behaviors, her own son, she described it as being lazy. And there's no judgment here, but when we put labels on behaviors and use characterizations like selfish, lazy, unreliable, scattered, then we sometimes will influence our own perception of the people we're trying to help. And of course, if we really see those symptoms as character traits, it can affect how our children see the behaviors themselves. So we really need to be careful in how we interpret the actions. Of course, keeping in mind that we're all also responsible for our actions and can't use the symptoms as excuses as well. But when we're looking at our children and those that we're helping, many of these deficits are linked to formal diagnoses. And those diagnoses, run a gamut. But if you look at this next slide, some of the diagnoses that go along with executive functioning deficits or have executive functioning deficits as a key component of their presentation includes, of course, attention deficit, hyperactivity disorder, and inattentive disorder, which is really sometimes held up as, Barkley would say, as an executive functioning disorder in and of itself. Our children with autism, previously we've also referred to it as Asperger's, but currently children on the autism spectrum disorder and adults often have executive functioning deficits. And it should be noted many children and adults on the spectrum also have comorbid ADHD combined inattentive or hyperactive type. Schizophrenia also is known for having severe executive deficits as part of its presentation. Depression, anxiety, Tourette syndrome, brain injury, all of these, obviously including dementia, are diagnoses that at their core share the common deficits related to many executive functioning skills. There have been some, too. I read that there are some disorders, including addiction, as well as antisocial behavior, that have components of executive functioning deficits. And clearly, those that may struggle with substance use, many of them have underlying disorders that we've already covered, and that the substance use comes as a way to help try to cope ineffectively with their executive functioning deficits. So then what we want to do as parents and supporters of our adult young children, when we're helping them and supporting them through this process of developing executive functioning skills, determining a diagnosis is an important part of establishing what they're dealing with. So the diagnosis we just went through, it is important when we look at providing services. As much as possible, it's wise to begin with an assessment. Now, that doesn't mean every assessment has to be formal, but as much as possible, especially if we're trying to plug into the system, the educational system, and vocational rehab, etc., we need to have data to support our children's struggles. So being able to anchor their executive functioning deficits to a clear diagnosis is important, and then to determine that level of severity and what they're dealing with so that a treatment plan and accommodations can be developed is of course our goal, so that we can target our help. When we look at formal and informal diagnoses, there's a couple of things to consider. Of course, we can informally, depending on our resources, get a pretty clear view of what our children are dealing with just based on our experience and interactions with them as they go through school and prepare for careers. When we look at trying to identify that, there are many measures out there on the internet that can give feedback. But again, as we referenced earlier, ADHD does tend to be a diagnosis associated very, very clearly with executive functioning deficits. And even if we're struggling more with a mood disorder and not just clear ADHD, this self-assessment in Barclay's work can give us an idea of what we're struggling with. What we do know is that for many adults that go from having a variety of symptoms associated with ADHD that may include impulsivity in their youth, as they get older and into adulthood, many of the strongest or most consistent deficits of executive functioning that follow them include response inhibition, struggle with vigilance, working memory, and planning. So this self-assessment is a way to help us identify with our children or adult children what they're struggling with. The other aspect when we talk about assessments is when we look at formal assessments, we often look at, for instance, on point 2, getting a neuropsych evaluation or a very extensive clinical interview to help us identify and quantify our executive functioning, the executive functioning skills we're looking at. A point on this slide to be aware of is that there's been concern in the field about, using neuropsych testing as kind of an end-all to, to determine executive functioning deficits. But what we're finding is that although neuropsych assessment can be very helpful in looking at some of the nuances, and especially related to functioning academically or with fluency and some of those kind of things that you can really parse and get details on in a neuropsych evaluation, the reality is in day-to-day work and life, they're finding that the best feedback as far as executive functioning deficits is looking in a real-life or ecologically valid situation, to look at what our children or adult children or clients are facing in a work situation and getting feedback in an objective way from a rater, for instance, a family member who knows the situation well, in a work environment, a supervisor or someone that really knows what that person is dealing with. They found that data through rating forms, especially of an observer, can be extremely helpful in having us quantify what level of deficit and we're dealing with. So some of that, the rating forms, that we won't go over them comprehensively, but some of the rating forms that are used are, for instance, the Barkley form that looks at deficits in executive functioning, and then also the brief is another one that's commonly used with children. The SEFI is also another one used quite often. But each of these measures is a way to formally identify without having to have a very, very extensive testing through the perspective of just neuropsychological comprehensive testing. This is more targeted towards specific executive functioning deficits that we see adaptively in day-to-day functioning in the work environment, at home or at school. So you'll notice on these two measures with the Barkley and the brief, they've been developed to focus on the different aspects of executive functioning, from self-management of time, self-restraint, which we talked about in the definition of executive functioning, self-regulation of emotions, motivation, problem-solving, to other terms that mean much the same, our ability to inhibit or stop ourselves from blurting out or from performing an action that can be unexpected, our ability to shift cognitively and plan and organize. So these rating forms can be very helpful. And just for those interested in the research side of it, when we look at neuropsych testing, we often, in more formal settings where we do the big assessment with the diagnosis, it sometimes isn't very clear that we go from a specific issue to specific deficits. There's often a hierarchy of different levels. Again, if we can get at the front end where our children or adult children are struggling, sometimes that data can be more helpful than what we see in more comprehensive neuropsych. Okay, then what we want to identify is, why is it so important to focus on executive functioning, especially when we're looking at helping our children enter or manage the work environment they may already be in. Barkley had I referenced just quickly a study he did where he wanted to see how often adults in his group he was looking at really see themselves struggling with their work and occupation. And 75% of those with executive functioning deficits and ADHD identified that it is very often a problem in their lives. Executive functioning impairments are associated with significant deficits in daily living and occupational functioning. In an article that just came out this week that was in the Huffington Post, looking at this issue, when talking to employers, they complain that many of our applicants don't seem to have executive functioning skills that they need to work effectively in today's market. There's a call for us to wake up to this issue. The economics professor at Princeton University, Cecily Rouse, was asked on PBS what one thing is needed to improve high school graduation rates. And in addition to stating that she would invest more in early childhood years and provide more support, including mentors for children in the 8th and 9th grade transition, she really focused on including in our curriculum ways to promote executive functioning. She said, quote, when you talk to employers, they say that students and job applicants don't have the executive functioning skills needed. Other research also looks at how executive functioning really predicts a child's achievement as well as IQ or better, because executive functioning goes beyond what our kids and adults need to know in a conceptual way and taps their abilities to actually use what they know in an effective day-to-day adaptive way. So just quickly, I wanted to show Barkley's work when his measure, that the Barkley's measure, the BDEFS, has what we call an executive function score that reflects deficits in executive functioning. And for those that scored the highest on his executive functioning score, you'll see that that is linked, seems to be correlated to lower levels of completing higher education. We also look at lower levels of income for those that experience the most deficits in the most severe deficits in executive functioning, and that can be quite dramatic. Okay, so what do? We need to help build executive functioning skills, both from an educational standpoint and as parents and mentors of children in working with them one-on-one in developing their skills. So do we match the deficits with their workplace accommodations and just kind of match that up? Absolutely. So, but at the same time, implicit in this title is, do we just match the deficits? No, we need to go, way beyond that. But to begin with, we need the data from neuropsych evaluations, but even more important, making sure that at the forefront we have those behavior rating forms to identify what specific deficits we're dealing with. And then we look at how those match up with accommodations that we need to be aware of in advocating in a school or work environment to help our children succeed. So we would look at things like if the executive functioning deficits are related to organization and time management. Look right here at the kind of ideas that we have to help them manage that deficit in a more effective manner so that it doesn't impair their functioning or impede their progress. So things like, scheduling regular meetings, using checklists. We have accommodations for memory and processing, using things like an audio recorder, providing written instructions, allowing for more time, attention, helping child or the worker break assignments down into smaller tasks and maybe parsing those out and giving them to them one or two tasks at a time so they're not overwhelmed by the full picture, providing structured breaks, mixing up the day so that tasks that are given to workers with attention deficits have, more intense projects that are interspersed through more mundane tasks. Social issues can be supported. Emotional regulation can be supported through accommodations at the workplace as well. For instance, assigning a mentor, allowing more flexible work schedule and where they work from. So that we really have a lot of great ideas and resources for us as parents, owners, and coaches to help our children and clients develop the right accommodations. But this, as I mentioned, as important as those are, it's important to do it in context of how do we implement these accommodations, how do we take the executive functioning deficits that have been targeted and really make a difference, an effective difference. So there really is not a lot of research that supports widely accepted interventions that target these capacities. But what I have been able to come up with is to look at areas that are promising and present those to you. The concepts that I think are really important when we look at those lists of accommodations that we want to put in place, how do we actually have our children or clients use those? And Barclay says too, executive functioning deficits really represent executive functioning deficits, meaning it's not a disability. The whole range of those diagnoses we look at, when we look at the executive functioning aspect, it's not a disability of knowledge. Many of our children we have worked with and our adult workers we've worked with over and over again, and they know many of the lists of accommodations that should be put in place that we just referenced. They know many of the steps that should happen, but the deficit in and of itself is a deficit not implementing those kinds of interventions and accommodations on our own when we're distracted, when we're in the work environment and don't have those accommodations right in front of us. That is the nature of the disability itself. So these are some just, great ways of trying to bring those accommodations into a place where they can be implemented meaningfully. And so I just wanted to talk about some of that. The point of performance concept presented by Barkley is one that I really like, and it talks about, builds on engineering the environment to facilitate performance. That executive functioning intervention should help workers with an active intervention at the point of performance. So when we fill out those rating forms, when we work with the supervisors at work or trying to develop accommodations, or in the educational setting, a 504 plan, we need to look at where the worker and our children present their deficits. Where in the work environment or in their schedule does it tend to fall apart? And then that's where we need to go and implement those interventions. And how do we do that? We can do that with putting visual, and I should have put audio here too, but visual and auditory interventions at the point of performance. For instance, if you have a crew with executive functioning deficits, say at a rehabilitation center where they're trying to train on how to effectively clean the bathroom, having a visual chart, having a checkoff list right at the bathroom door or at the clipboard that needs to be done as the tasks are completed would be an example of putting the intervention at the point of performance. I also mentioned just briefly goal management training, which is something that has been looked at that uses awareness of self-awareness and executive functioning skills. Specifically, GMT is supposed to train a patient to stop ongoing behavior in order to define their goals and to monitor performance. The idea is to use external prosthetic or self-cueing prompts to help internalize the need to, implement those interventions right at the point of presentation. So goal management training tries to use some of the same concepts that Barkley brings up with the point of performance. I put a question mark because some of the studies indicate that although it has great ideas, we really need to link it clearly with environmental and occupational changes to the environment so that these skills can be, the internalized skills can actually be connected with hands-on interventions. And that goes into what we see beneath engineering the environment to facilitate performance. And how do we do that? We really need to look at helping ourselves as parents and coaches encourage that internalization of developing strategies and using outside prompts in the environment to trigger in our children's minds the knowledge that they have in there, bring them to awareness at that moment when they need to use these interventions. So again, the accommodations are so important, but it has to be done in the context of the big picture. And when we look at the big picture, that includes, when we look at, in this picture, a care setting, we need the aspect of self-awareness and regulation, but we need it in context of a climate where they're supporting, it's not adversarial, looking for failure, or they're going back to the idea of labeling behavior as being lazy, but realizing to help our children and workers regulate, often those cues and interventions need to be on the front lines in the work environment itself. It's more than just a checklist of we've taught these skills. It's more the checklist in the moment or in the environment, so that we can help increase their awareness. Carol Dweck says it's more about teaching self-awareness than skills per se. So we need the skills, we need the specific checklist, but we need to really promote the idea of self-awareness, mindfulness, the ability to be self-aware to the point that self-regulation begins to occur. And these are important skills, not only for our children who are trying to develop those skills, but ourselves, to develop our own awareness about how we approach these matters so that we do it in a way that engenders confidence and a positive perspective. I put in here just a wonderful resource that is provided through the government. It's called the Job Accommodation Network. And if you go to this site as parents and job coaches, you will find so many helpful hands-on ways to implement what we're working towards, which is increasing each of our clients or the people we're working with increase their own mindfulness to use these skills. And to just show you the specific resources on that website, they focus specifically, one of the presentations available through the website is related to executive functioning in the workforce, and they really go through different accommodations similar to what we had on 2 or 3 slides ago, looking at accommodations focused on the issues we deal with. One thing that was specifically addressed in their PowerPoint is how specific accommodations, which again we've touched on, but they go through, they have a lot of great resources related to social skills, organization, time management, with very good specific accommodations. And then they also have specific examples of situations and solutions that can be used so that when we're working with our children or helping advocate for them or clients, we can find specific examples of the kind of things that can be expected to be done in a work environment when we implement these accommodations. So, for instance, the first example I found on their website was a mail clerk with intellectual disability. He belonged to several coffee clubs in his workplace, so he could collect mail first thing in the morning and have a cup of coffee with each department of the building. And what would happen is he would get involved in conversation and then forget what he was doing. And by the time he was finished with the first round of mail, it was lunchtime. The same thing was occurring in his afternoon mail run. So as a solution, when we're again looking at ways to help compensate for his specific executive functioning deficits, his employer decided to accompany the mail clerk and time him as he picked up the mail with no coffee stops so that they would have an idea of how long to allow for his mail run each morning. His supervisor then set a timer, showed him how to pace himself, and indicated where he should be halfway through the pickup. So by helping him to manage his time better, again by in person, setting a timer that visually was there, writing these things down, showing him probably a rubric that allowed him to know when this task should be done. They were visually helping him at his point of presentation where he was falling apart to manage his time better. And from that, the supervisor was able to get several more tasks completed by the employee throughout the day, rather than just the 2 mail collects. And then, so just quickly, another example was a retail employee with ADHD who often forgot the closing and cash out procedures. And again, that deficit would have been found by doing, an assessment, including things like executive functioning assessment, but an interview to really find out where things start to fall apart for each employee. But this particular employee forgot about the cash out procedures, and they would miss out on printouts and Excel reports they needed. So again, at that point of presentation in mind, the employer created a numbered checklist that identified each step for closing procedures in a proper manner and identified which reports to run from the cash register. And so this visual prompt and rubric, of course, helped all the employees, but more specifically this employee who was struggling. The last example, and again, these are all kind of case studies you can find at the website in this particular presentation to help you as you look at your own child, what you need to help develop related to accommodations at the point of their specific deficits. Here's one last example of a paraprofessional who worked in a special education setting. she had a learning disability and she couldn't pass a required state test that she was supposed to keep her job as a paraprofessional. But she had excellent evaluations, she did a wonderful job, and she had no performance problems. So to accommodate for this specific issue related to her at the point of performance, her point of performance deficit was not being able to pass this test. So instead of firing her for not meeting that policy, the school board asked the state to accommodate her by changing the policy that would allow them to evaluate her skills and abilities through a different means so that she could show her competence and be evaluated, but through things like interviews, past work experience, demonstration, and observation. So I think those are excellent examples of how we can help advocate and help our own children as adults advocate for themselves as they identify where their point of presentation or deficit is. And then I did want to highlight, I love these books in relationship to helping us on a personal level as our children and clients grow and have to take more of their own responsibility in advocating for themselves. These resources are very helpful and also helpful to us as we help prompt our children in remembering the skills they need to deal with their executive functioning. So in the spirit of going beyond just looking at the list of accommodations, the book by Barkley, Taking Charge of Adult ADHD, again, not to poo-poo all the other syndromes, but many of these executive functioning deficits go along with anxiety and depression and TBI, and these, so his feedback really applies to executive functioning in general. And then also Tuckman's book on understanding our brain to get more done. I've taken some of their ideas, and you'll see on Barkley's 8 rules, his rules on taking charge of executive functioning deficits will be in italics, and Tuckman's are in bold, just so that you know. But one really great tip or rule that we can work with with our children and ourselves as adults that have executive functioning deficits, things to help us put in place the accommodations that we advocate for are how do we ourselves stop the action? How do we develop our mindfulness and help our children develop their mindfulness to implement these techniques? So one is just what we call stop the action. Perform a simple action to stop, to kind of stave off your urge to act and sometimes make choices that reflect negatively on our capacity. So, you know, talking model, starting out when you're responding with a slower tempo so that your mind has time to catch up. Set up ways to keep you from just jumping in. Some people will literally say, right before they respond, or, okay, let me think about that. Oh, you're right. Just a little kind of important statement that gives their mind enough time just to stop the action and to be more mindful. See the past and the future. We talked about an executive functioning definition. Executive functioning's ability to, in context of living, is our ability to see the past and the future and to activate what we call our mind's eye. So some of the strategies there are to use visual imagery to turn on our mind's eye and to see ourselves in a way where we are looking for our adaptive behavior and how we need to monitor and maybe adjust that. We've talked about this, but using actual visual aids at the point of presentation can help switch on your mind's eye so you're more mindful. Creating a schedule that you can visualize or have right in front of you. Scheduling time, talking it through, and as you talk it through, picturing past events to help you be mindful. So that rule is called see the past and then the future. 3 then is activating more that auditory part of the brain and using the auditory interventions in the environment by saying the past and then the future. And that's when we mindfully activate the voice in our heads so that we can control. So when we teach our children self-talk, and I see this so much in younger children as they're preparing educationally before they get into the work environment, those that learn to talk themselves through a process, tied to strategies they've learned to review their work, to ask if what they're doing is meeting the objective, to see if they're pacing themselves in a way that's leading to a timely completion. Those children that take those strategies in and learn to narrate as they are functioning in an academic situation can take that to the workplace and use those same skills. Do I have all the supplies I need to put this together? Am I doing step one? Look at the time. Am I within the rubric of what time I need to do this? As they develop those habits, the accommodations can be so much more useful because our children or the worker is taking responsibility for making that accommodation work. Rule 4 is externalizing key information. And it's, there's a lot of crossover with these, but that's putting physical cues in plain view at the point of presentation of where we are struggling. So, reminders of the little stop sign, reminders of where in the day we get stuck visually really can help us then implement the accommodations that we need to be effective workers. And great examples there. For instance, make a list of steps or procedures you want to follow the next time you encounter a problem or task. And a lot of these apply to the kind of case studies we reviewed earlier, the kind of things we want to put in place in the environment to help keep that external reminder and cues so that we can work as effectively as possible. Helping you stay motivated and feel that the future is using a strategy of what it will feel like when I get this done. And I use this often with my clients in therapy is visualize, verbalize it, feel it. What keeps us going towards a bigger goal? How do we stay motivated, especially when motivation is a key executive functioning skill and so often deficient when we have executive functioning deficits. So we have to, again, internalize and make it more real by attaching what we need, the meaningful emotions and pictures so that we are more likely to stay focused. In that same context, Rule 6 says break it down and make it matter. So when we see the big term goal, that's awesome. We want to know what it's going to look like, feel like, be like. But then when we come to the present, we need to then break it down into small steps so that we're more confident that we can make that ultimate goal. So, and we've talked about this in the accommodations, but chunking things down, giving tasks to employees at one step or two steps at a time so they're not overwhelmed by the whole picture. Having to check in with your supervisor more often than others may to keep you motivated, to keep aware that you're moving down the list of objectives you need to get through. Building in little rewards so that you again can build that motivation and that connection to some senses about what it feels like to accomplish your goals. Okay. Rule 7 is make problems external, physical, and manual. Learn to simplify problem solving. So we want to use any tools we can to help solve problems. Identify strategies that have worked in the past. Identify what gets you stuck. If you have a tendency or you're at work and the client has a tendency to, surf the web when they need to be focused, what can we put it at the computer screen to remind them that surfing the web is not allowed or something we don't do during that time of that specific task. So think of the obstacles that get in the way and do something external and manual to help accommodate for that. And Dr. Barkley then, talked about keeping your sense of humor, not being so serious or so worried about implementing all these accommodations that we don't allow ourselves to be human and realize that executive functioning deficits, are not going to completely go away, that we can accommodate them and that we can do it in a kind of positive way where as we're gaining skills, we're not beating ourselves up. And so finally, I love this quote and I use it often with my clients. and it's between stimulus and response there is a space, and in that space is our power to choose our response, and in our response lies our growth and freedom by Viktor Frankl. I love that quote because it really brings down to us when we're working and trying to help our children and our clients deal with executive functioning deficits. It's really a matter of being able to bring it all down to that point of presentation in the moment where some stimulus is there to possibly pull us away or to get us in a place where we are not being effective decision makers, problem solvers, and workers. So if we can take all this great data that we know is out there, all these great accommodations, but implement it in a way where we're using strategies, where we're using it from a metacognitive viewpoint and have built an internal resource to know what strategies work, to know what externally we need to put in front of us and our workers to help trigger the skills they know. Because remember, it's not a deficit of knowledge. They know these skills, but how can we help externally trigger their internal awareness and mindfulness to put these accommodations in place? So really that magic space that we're all dedicated to in helping improve the lives of our children and helping them be and advocating for them to be able to have meaningful careers and jobs is to help put in place with their supervisors and with their own internal awareness that space between stimulus and response where they have the power to choose. And when we choose using these positive things that we've learned and are learning and are advocating for, then our children and our workers can grow and grow into the workers they want to be. Thank you very much.